Hello everyone, a very warm welcome from Mohammed bin Rashid University of Medicine and Health Sciences. Just to quickly introduce myself, my name is Norbert Nowotny and I'm Professor of Virology at the University of Veterinary Medicine in Vienna. And I'm also visiting professor at the College of Medicine, Mohammed bin Rashid University of Medicine and Health Sciences in Dubai. Let us talk a little bit about the causative virus. It is a novel coronavirus, and this so-called SARS coronavirus 2 is, and therefore also the name, it is genetically 80% identical to SARS coronavirus 1. You know the SARS epidemics which happened in 2002, 2003. So it is closely related to this virus. However, it behaves quite differently. Novel virus means that no human has immunity against this virus. And this is therefore a big problem. The whole family of coronaviruses, it's a big virus family, and they are all enveloped RNA viruses. What does that mean? That's the good news. The envelope consists of lipids, of fats. And that means that the virus can rather easily be destroyed by soap and alcohol-based disinfectants. It's an RNA virus. There's a little bit bad news because RNA viruses tend to mutate. Thus, new virus variants may emerge. But so far, that did not happen, because actually this virus has no reason to change its strategy. It is highly successful, unfortunately for us. What is the origin of this virus? The virus reservoirs are bats. Bats are carrier of many different viruses, including several coronaviruses. But the bats don't get sick from the virus, but they shed the virus in their excretions. And if these excretions are picked up by other animals, we call them intermediate hosts. And in the case of the novel coronavirus, this intermediate host seems to be the pangolin. Then it can happen if, what we know now, these pangolins and many different species of animals are presented at live animal markets in China. So people going to these live animal markets, they are or may be exposed to such viruses. And this is most likely, as it happened, that the virus spread into the human population. We know two other coronaviruses which emerged as new human viruses in the past 18 years. As I already mentioned, SARS virus, 2002, 2003. Altogether, we had 8,000 human cases and 800 deaths. So that means the case fatality rate was about 10%. The intermediate host in that case were palm civets. And they also originated from a live animal market in China. Interestingly, this infection disappeared after 1.5 years. Unfortunately, this will not happen with the current SARS coronavirus 2. Another coronavirus which emerged was MERS, Middle East Respiratory Syndrome coronavirus. That happened in 2012. And the disease is still ongoing. So far, we had 2,500 human cases and 800 deaths. So that means a case fatality rate of 35%. The intermediate host is the dromedary camel. What you can see here is our group, the team taking samples at the camel market, because we are researching MERS already since a long time. All human cases so far originated from the Arabian Peninsula, 80% from the Kingdom of Saudi Arabia. We see continuing introduction from dromedaries to humans and limited spread within humans all the time up to now. So again, how does this transmission from wild animals to humans work? The reservoir hosts are usually bats, different species of bats. And then we have intermediate hosts. In case of the first SARS coronavirus, that was the palm civet. In case of MERS, these are the dromedaries. And from these intermediate hosts, the virus spreads to the human population, and it spreads within the human population. Now let's go to our current coronavirus, COVID-19. Which are the clinical symptoms? Fever, but not necessarily very high fever. Cough, shortness of breath, fatigue. It may lead to pneumonia in high-risk groups. And probably there is a certain percentage of people without clinical symptoms. Clinically, it cannot be distinguished from influenza or the common cold. And this is the pandemic. This website from Johns Hopkins University gives you the most updated numbers, and I updated it about 1.5 hours ago. So you can see we have currently close to 170,000 cases worldwide, 6,500 deaths, but luckily also more than 77,000 people have already recovered. 148 countries experienced or reported infections. So therefore the WHO also declared it a pandemic. Here a little bit a closer look. As you can see, most cases at the initial place in China and other places in Asia. However, Europe is experiencing right now a huge uprise in cases, and also in North America, a lot is going on right now. At the moment, the Southern Hemisphere does not report as many cases, but I'm pretty sure that will happen soon. So at least the countries in the Southern Hemisphere, they may have a little bit more time now and should use this time to prepare themselves properly. This is the challenge. I don't know whether you saw this graph before. And yes, this graph is scary. What you can see, these are the age groups of people. And here you see the so-called case fatality rate, meaning how many, which percentage of people which are diseased may die. Up to 50 years of age, we can say the rate is about 0.2%. So that means 2 people out of 1,000 may die. In the age group 50 to 60, it's already 1.3%. 60 to 70, it is 3.6%. And it gets really dangerous and scary in the age group 70 to 80 with 8%. And 80 plus with close to 15%. These data are from almost 45,000 confirmed cases from China, and they are quite reliable, and the source is the Chinese Center for Disease Control and Prevention. So who is at risk? Elderly are at risk. Particular increase in fatalities we see from 70 years of age onwards. In addition, people with pre-existing chronic diseases, such as diseases of the lung, cardiovascular diseases, including hypertension and diabetes. Of course, also immunocompromised. So far, the worldwide overall case fatality rate is 3.7%. However, the case fatality rate, for example, in Italy is 6.8%. So what is the reason for that? The main reason is the age pyramid. there are more elderly in Italy than the worldwide average. And this actually holds true for the Western world in general. The good news is there are also a number of people who are not at risk. These are healthy, pregnant women, babies, children, young adults, and adults up to approximately 60 years of age. Have a look here. These are different population pyramids, and we compare here China, Austria, and the United Arab Emirates. And I marked for you all those in the age group 70 plus in red. So you can see here, these are the people older than 70 in China, on which the 3.7% rate or case fatality rate comes from. If you look at Austria, and in Austria we have a similar situation compared to Italy, you clearly can see more elderly in Austria, and this holds true for the whole of Europe and also North America. This is very different to the UAE. You can see in the UAE there are just very few people which are at a higher risk compared, for example, to Europe or North America. You may also have heard that it's now everywhere in the media, flatten the curve. That's what each government tries to do, and that's what each individual also can help with. What does that mean? If you have an epidemic or a pandemic, it will go up to a certain point and then it will go down again. However, if we let it go without any intervention, the healthcare systems will be in big trouble. So where are we now in this curve? Probably we are somewhere here, at least in Europe and North America. So the number of cases will increase. It will definitely increase, let me say, in the next 4 to 6 weeks. So what do we need to do? What do the government needs to do? Flatten the curve. Because if we have a peak like this, it will be a real challenge for the healthcare system. The availability of beds in the hospitals and also beds in the intensive care units, in the ICUs, that will be a challenge. So, and I will let you know in a minute, we need to reduce the height of this peak. And we also will delay the epidemic peak. So the whole epidemic will take longer. However, the challenge for our healthcare system will be less. So that's what we all together need to achieve now. Your contribution counts. So it's not only wait for governmental restrictions and governmental actions, but you can do something, and please do it, and do it now. I give you here some suggestions. Strictly follow the updated regulations from our government and healthcare authorities. Demonstrate social distancing. By the way, this expression is not right. So I would say not social distancing, but say physical distancing. Stay away from almost anyone about 2 meters. Why? In order to transmission by the most likely way of transmission, and this is by droplets. And you can increase your social contacts by social media, but keep the physical distancing. If you need to cough in your elbow, if you don't have a tissue around, don't cough in your hand, because with the hand you will open the next door, and the next one who is coming might infect him or herself. Practice frequently hand hygiene because of possible virus transmission through contaminated surfaces. Avoid touching your face, especially eyes, nose, and mouth, before washing your hands. And if you develop respiratory symptoms, stay at home and call your physician or the coronavirus hotline, which has been established essentially in each country. Just a quick look to one of the many other issues. You may have heard about temperature scans at airports. How effective are they? This is a recent study published in Neurosurveillance, and you can see it's a modeling out of 100 infected travelers at exit screening and entry screening. Altogether, 53 out of 100 have been identified, but 47 have not been detected. Nonetheless, continue doing this airport screening and the temperature scans, because at least you can remove or these 53, so more than half, which will not continue to spread the virus in the country where they travel to. So it is a good thing to continue temperature scans. Let me show you here a comparison of the case fatality rates with the flu. Because everyone says, and especially initially, people said, well, it's like a flu. It's not different to a regular influenza. Unfortunately, it is. So the case fatality rate with the seasonal flu is usually around 0.1%, maybe in some countries up to 0.2%. You recall or may recall the last pandemic we had in the world, that was the so-called swine flu in 2009, 2010. And actually the case fatality rate with in the swine flu, it was less than a seasonal flu, 0.07%. And now we experience COVID-19. We cannot say general what is the case fatality rate overall, because it is highly dependent on the age structure of the population. It may be between 0.2% for countries with a predominantly young population, and it may go up to 6.8% or even more for a population with a high percentage of elderly. Just quickly, in the next very few slides, a comparison with influenza. You know, influenza pandemic we experienced during history, several of them. You know, the most devastating one was the Spanish flu, 1918, 1919, then Asian flu, 57, 1968, the Hong Kong flu, and so on. Coronaviruses have as a genome, their genome consists of one molecule, one large molecule. In influenza viruses, it is different. They have a so-called segmented genome. So the RNA genome consists of 8 segments. And we know many different influenza viruses from humans, from birds, from swine, and also from other animals. And they may reassort so that new influenza viruses are established. And again, no human being has immunity against such a new influenza virus. Therefore, influenza viruses are also dangerous. Regarding the pandemic flu, it was a little bit more complicated how this influenza virus was established, but that was essentially the end point, and this one caused the H1N1 pandemic in 2009, 2010. It looked like this, 27th of April 2009. You know, it started in Mexico. It was also called initially the Mexican flu. Then it infected large parts of North America, and the first case in Europe was seen in Spain. So remember, 27th April 2009. Then already 6th May 2009, it spread in Europe. 27th May, it spread further and also to Australia. 17th June, it spread further. And 1st of July, it was almost seen worldwide. So only within a few weeks, essentially the whole world was infected. And this is the end point 1 year later, 15th August 2010. You can see absolutely all the world has experienced this H1N1 influenza, swine influenza pandemic. In general, we can distinguish between different phases of a pandemic. Not only with influenza viruses like this, the similar situation we will have now with COVID-19. So initially, phases 1 to 3, we have predominantly animal infections, very few human infections. Phase 4, we have sustained human-to-human transmission, and then we have the phase of the pandemic, which we are now in case of COVID-19. We see widespread human infection. And then the peak will go down, and we have a post-peak possibility of recurrent events, and thereafter the disease level will become small. How does this work? We call it herd immunity. That means if a certain percentage of the population got the infection, and with COVID-19 it's like this, that we also have a good number of asymptomatic cases, so people which are infected but they do not show any clinical symptoms, but nonetheless they contribute to this herd immunity. Also, all these mild cases contribute to this herd immunity. We do not know how high the percentage in the population must be until the virus stops its activity. So people said it could be 10, 15%, 20%, or up to 70% of people. And if a good proportion of the population has experienced this infection, clinically or subclinically, then the virus will not find enough hosts for new infections, and then the infection and the disease will decline. We expect actually that will happen within, let me say, 2 to 3 months, probably rather 3 months. So what is the outlook with COVID-19? The next 4 to 6 weeks will be tough. There will be severe restrictions in place affecting essentially all areas of life, and the governments have to do this. However, your government will assure availability of the basic necessities and normal functionality of essential services. I expect that the pandemic will conclude in 2 to 3 months from now. Therefore, let's dive through this period smoothly and healthy and enjoy the upcoming summer even more. Ladies and gentlemen, stay healthy, stay positive, and help each other, especially the most vulnerable of our population, and these are the elderly. Thank you very much for your attention, and I'm now very much looking forward for your questions.
Thank you so much, Professor. Now we're going to start with the questions that we have received. Question number 1, how dangerous is this virus? Is it deadly?
As I said in my presentation, it depends on the age group. If you are young, or let me say up to 50 or 60 years of age, then it should be a mild flu-like disease and it should not cause a big problem. If you are older or if you have comorbidities, then it might be dangerous, and then it might be necessary that you seek hospital care.
Second question, should I be scared?
No, you should not be scared, but you should be prepared.
Third question, why are everyone panicking?
There is no need to panic, but of course I understand why people are panicking, because if we look now at governmental restrictions, such restrictions did not happen since the Second World War. So I understand that they panic, but in principle, this is not necessary. If everyone contributes with his or her part, what I said in one of the slides, you can make the difference. If you do these things like physical distancing, increased hand hygiene, and so on, of course, don't travel, isolate yourself if necessary, then you will contribute that this pandemic will end sooner than later.
How long does the virus survive on surfaces?
Good question, and there is no real answer to this question. It depends on the surface, it depends whether it is indoors or outdoors, so it is essentially between a few hours and 1 to 2 days.
There are some people who don't get symptoms but are tested as having the virus. Do they just recover? And how do you know if will they show symptoms later?
No, they will not show symptoms later. They have a strong immune system, and they get either the disease in a very mild form or do not show symptoms at all. So they will get immune afterwards, and they will not develop symptoms thereafter.
But they still infect others.
Yes, this is unfortunately the negative effect. We know that even asymptomatic carriers of the virus may infect others. And actually, it is also during the last, let me say, 1 or 2 days of the incubation period, where you also do not know whether you are infected. Also during that time, infection of others can happen. We know that, for example, from the first case in Germany.
What is the difference between COVID-19, influenza, and the common cold?
I tried to explain it in my slides. So the viruses are totally different. Clinically, actually, you cannot differentiate between common cold, influenza, or COVID-19.
Does it spread through water, like swimming pools?
I'm not aware of that.
Can the infection from pets, can you get infection from the pets or animals?
Another good question. There is one case of a dog in Hong Kong. And this dog in Hong Kong was owned by someone who had COVID-19. And the nasal swab of this dog tested positive. But meanwhile, they also did an antibody test, and the dog did not show antibodies against the virus. So it is most likely like this. You know, dogs are sniffling around, and since that was in the setting of someone who was sick, so probably on a surface or so, there was the virus, and the dog sniffled that virus. And since these tests are highly sensitive, the virus was picked up by the test, but this was so far the only case, and this was, as it seems, just a mechanical transmission to the nose of the dog and not an infection of the dog.
Can mosquitoes bites transfer the virus?
I love that question because mosquitoes are one of my research areas, and viruses transmitted by mosquitoes. No, this is highly unlikely in this case.
Do asthma sufferers get it worse?
We are not sure yet. Of course, every pre-existing diseases of the lung could be a little bit dangerous for developing more severe diseases, but we do not have enough evidence yet.
The steaming surfaces kill the virus?
Of course, we do not know exactly which temperature the virus survives, but I'm sure that, for example, 70 degrees will kill the virus within seconds.
There's also a rumor that's been going around that with the summer heat that would also, or is it because of?
I know that question. It's like this summer heat. Yeah, if in the UAE, where it has up to 50 degrees outside, but it's not the heat alone. It is, the virus or a droplet with the virus, if it is outside and the sun, and it's not only the heat of the sun, but it's also the UV light. It is also the drying out of this droplet, because if the virus dries out, then it is also dead. But indoors, it will not have any effect.
Have we reached the peak, or do we expect things to get worse?
No, we have not reached the peak. We have to be realistic. It will take another 4 to 6 weeks until we reach the peak. However, in China, they reached already the peak, and this is the good news. After, let me say, 3 months now, we see a clear decline of cases in China. So I think it was yesterday that they just reported 8 new cases. So that gives us hope, but the next 4 to 6 weeks in the rest of the world will be tough.
Is there any genetic or race factor that makes someone more susceptible to the virus?
Such a factor is not known as by now. So in principle, all ethnicities should get the infection in the same way.
Why is it spreading too fast?
Because it's a new virus. No human being has any immunity, any antibodies against this virus. Therefore, it is spreading fast, and the population needs to get a certain amount of immunity, and that we call herd immunity.
Iran and Italy are now dealing with a huge number of cases. Why is that the case, despite the quarantines in place, specifically in Italy?
I would say that one has to be very careful and closely look at the situation. The tests are now widely available, these molecular tests. These tests should be used in order to identify clusters of infection as quick as possible and contain such clusters. And it might have happened that in some countries, these clusters of infections or first clusters of infections were not identified in time.
How often should we clean our phones?
Well, you can clean your phone with any alcohol containing disinfectant. Every couple of days would be a good idea.
What does it mean when the World Health Organization announced that it's a pandemic?
It does not mean much, because especially it does not say anything about how severe the disease is. It only says that the spread of the disease was worldwide.
How long until people get better after getting infected?
It is similar to a flu. So you can expect about 10 days to 2 weeks, and thereafter people should get better.
Did they find where the source of the virus is from?
Yeah, I told you at the beginning of my talk.
Okay. What treatments are currently used to combat the virus?
There are no specific antiviral treatments available. So we call it symptomatic treatments. So just the symptoms are treated in the usual way. However, of course, scientists around the world are putting a lot of effort to develop specific antiviral treatments also against COVID-19.
As a dental surgeon, should we wear an N95 mask for every dental patient we see? And shall we only see emergency patients?
I think definitely you should wear these N95 masks, or as they are called now, FFP3 or FFP2 masks, because as a dental surgeon, you are close to the face of your patient, and you should do that.
From where did these bats get this infection?
These bats have lots of these viruses, and probably the viruses mutate in the beds. And if you know, we don't realize that, if you know about 25% of all species of mammals are bats. So there is also a huge number of bat species, and therefore they also carry a lot of different viruses.
Okay. Is there an explanation for the few reports from Russia?
No, I don't have an explanation for that.
Are pregnant women at risk, as current data suggests that pregnant women have reduced immunity generally, especially those in medical and dental field?
This is correct, but as far as we know by now, pregnant women are not considered a risk group.
Does Japan have similar case fatality rates with their high population of elderly?
Honestly, at this point of time, I don't know. I would need to check, but I can imagine that because elderly are especially are clearly a risk group, that's the same happens to Japan.
Are there metrics during the upward spike of the infection that can help in predicting the degree and the duration of flattening the curve?
Absolutely, and actually, each country is doing that now. Because they know the dynamic, they know their population curve. They know the pyramid of age in their country, and considering that, they can assume a certain case fatality rate or how many severe cases they may get. So each country now is individually modeling the disease for their country. So they, in order to be able to know what will happen in the next, let me say, 1 or 2 months, or until the peak of the pandemic comes, in order to be able to assure that there are enough hospital beds and ICU beds available.
How safe is it to use public transportation?
Well, if there is any chance, don't use public transportation now, or restrict it, or try to stay away from anyone 2 meters. So definitely public transportation in these days is probably not a good thing.
Another question about medications. If you have the disease, what kind of medications that you can take to reduce the symptoms, paracetamol or
in principle, look, it's at the moment like this in many countries that if you have flu-like symptoms, it's highly likely that it's not the coronavirus, but it is either influenza or one of the many viruses causing the common cold. And therefore, you can essentially use all your medication for flu-like symptoms, common cold, which you have at home. But please do not use antibiotics. As you know, antibiotics do not work against viruses.
How long does the medicine take until it starts becoming effective? Or there's, as you mentioned, there's no medicine.
Currently, there is no specific medication available. However, researchers are working hard to find one. And what they are doing right now is they try antiviral medications which are already currently licensed and used for other viral infections, whether that works also to reduce the disease burden and the clinical symptoms in COVID-19 cases. Because in these cases, it's like this, that is already known that these medications do not harm the human being. They are already licensed. So that would be the best and the quickest. But it's also like this that COVID-19 specific antiviral medications are also under development. The bad news is regarding a vaccine, because this is also a frequently asked question. Probably it will take another 6 months to a year to develop a vaccine.
Is it true that Italy, more younger patients under 50 are in critical care compared to elsewhere?
I did not see these figures, so I cannot comment on that.
Do we know anything about getting the virus again, even if you got?
Again, a good question, because there was one report, I think it was in Japan, that someone 3 weeks after first infection again got positive. I think something was wrong in that case with the test. So biologically, this is highly unlikely.
Is there a risk of long-term effects?
We know this virus infection now since 3 months, or a little bit more than 3 months. So I think we do not know enough about long-term effects now.
Will humidity affect the virus?
Not really. I think viruses love it humid.
If I was a young adult, can I pass the virus to babies aged 3 years? Babies 2 or 3 years?
Yes, you can, but even babies 2 to 3 years of age will not develop a significant disease. The problem is more that younger ones, children, and so on, bring the virus to the elderly home, to their grandparents, and they may get sick severely.
One question that we got is, I'm planning to get my daughter from the Netherlands soon. Do I need to isolate myself as well as she be coming through 2 airports?
Good question. Probably to isolate yourself for these 2 weeks might not be a bad idea. You know why these 2 weeks? The incubation period of this virus is 2 to 14 days, and therefore it's kind of internationally accepted now that the maximal incubation period is 2 weeks. So if someone is getting infected at the very last moment and goes home, staying home for 14 days means to be on the very safe side.
We have another question. I heard that the reproductive ratio of R0 of the virus goes down in summer due to both changes in infectivity of the virus due to temperatures and humidity, also due to the changes in human activities with weather change, and it's not due to herd immunity. Would it be reasonable to expect this of the COVID, like we see for the other coronaviruses?
Honestly, we do not know yet whether, currently the basic reproductive rate is R0 is close to 3. So one, to explain it for the audience, one infected person is able to infect up to 3 others. Whether that rate may get down during summer, we need to see. But as it seems right now, the pandemic will hopefully anyway be over in about 3 months from now.
Is there any possibility of it mutating in the host?
It is mutating. This virus is mutating all the time, and therefore, especially virologists have a close eye on that, and they sequence available strains from patients and try to correlate the genetic information they get with the clinical picture. So at the moment, we do not see any more pathogenic variation of the virus, but we have to closely follow up on that.
Do people who had a bout of influenza in the past 2 to 3 months and recovered, are they less likely to get infected by COVID?
No, because these are 2 totally different viruses, and immunity against influenza does not give immunity against COVID-19.
How sensitive are the diagnostic tests, and when will this test show positivity in an infected person?
These tests are highly sensitive. They are really sophisticated tests, molecular tests, and their sensitivity is about 99%. Also, the specificity of these tests is about 99%. And now we are all looking forward to get point-of-care tests. which can be done within, let me say, 10 or 15 minutes. Because right now, these tests take about up to 4 hours and need a sophisticated laboratory equipment.
Can it be transmitted by food that is handled?
Food that has been handled, not really, because currently we have just a human-to-human transmission, which is either by droplets, you know, if someone coughing and the other person is less than 2 meters away, and the droplets lands on one of the mucosa in the face, then it is the transmission works like this, or indirectly via, for example, doors, doorknobs, etc., but not really by handling food.
Do we know the mechanism of action of coronavirus?
It's the same as with all viruses. So the viruses affect cells, and in case of this particular coronavirus, it's a respiratory virus. So the target cells are, for example, lung cells, and then it replicates in these cells, and it causes inflammation, which at the end may lead to pneumonia.
What's the difference between isolation and quarantine? We've been getting a lot of this question.
Difference between isolation and quarantine, I think it's the same. The people need to stay at home for these 14 days.
And where can we go to get tested usually?
This is handled by different countries in a different way. So ask your government who is handling that issue via their agencies, and this is done differently in different countries. Usually, only those people get tested or are allowed to be tested which have been identified by some kind of authority. And you personally can usually not go and say, I want to be tested.
Another question that says there's been some talk about ibuprofen with dangerous effects on health to be used.
I heard that, but I cannot really imagine why. So to me, at this point of time, this is rather fake news.
Okay. So just to confirm, once you get the virus, that you will, and you clear, become better, you will have antibodies of said virus?
Yes, you will have antibodies and you will have immunity. At this point of time, we do not know how long the immunity will last, but usually it should last a couple of years.
Another question is there any dietary changes that we need to do?
No.
And I think that's the last of the questions.
Okay, so thank you very much, Shada. Thank you very much, all of you. And stay healthy, stay positive, and help each other. And many thanks for listening.